At the Innovation in Dementia and Aging Lab at the University of British Columbia, researchers are studying whether robots can help people with neurocognitive disorders. In 2024, they introduced these carebots called Lovots, a combination of love and robots, into long-term care homes in Canada. Kiwi and Mango use AI and machine learning to emulate lifelike behaviors. They don't talk, but can react with different sounds and movements depending on how their human users act. Lab founder and nursing professor Lilian Hung says she was surprised to find normally quiet residents with dementia open up.
They are quite quiet, but when they have these robots in their hands, they will talk to the robot. They use a lot of creativity. They don't only ask a question, but they will also provide an answer. They will speak for the robot. It's kind of like when you have a cat, right? So you kind of like interpret whatever the robot. So they exercise their brain in terms of using the creativity to interact with the robot.
These robots have the advantage of being available for interaction 24/7, unlike an animal or a person who can tire or choose not to engage. Hung says there's another reason why a robotic friend can sometimes be more effective than hanging out with a human.
They stop talking because they're afraid that they're being judged about saying the wrong things or they're not being perfect, and they will start to lose their language. Their language can decline very quickly. But having something like that to keep up with their language skills, I think that's really important.
In not so many words, I am their guinea pig in their projects.
Mario Gregorio has been an important part of this and many other of Idea Lab's research projects, including bringing a seal-like pet robot called Paro into hospital settings for patients with dementia. At the age of 57 and working as a data analyst, Gregorio found himself forgetting things he said and unable to read his notes. He says his world came crashing down when a doctor told him he was diagnosed with vascular neurocognitive disorder, and that it'd be 7 to 12 years before he'd likely be in a care home. But 17 years later, Gregorio is instead utilizing his experience to bring a unique perspective to projects that examine how people with dementia connect with technology.
It is interactive. It sort of look at you and then look at the temperature of your emotion. If you're happy, the barking will sound happy. And sometimes these lovots will ask to be picked up and hugged. It's like a baby, a dog, and a cat combined in one. It doesn't ask for anything. It just loves to be a companion. And I think this is very important.
Gregorio is excited about a potential future filled with humanoid robots serving as a support system for the caregiving industry. But he believes that such robots should not be overly human.
Probably making it look like a person is not a good idea because it could cause stress and all those kind of other things, because sometimes they look at the mirror and somebody is in the room, and these are issues that we need to look at.
Hung says privacy safeguards in robots must also be taken seriously, but she believes AI has the potential to make robots vastly more effective for people with dementia.
Using machine learning to getting to know the person, so then it makes the conversation a lot more personal. Then they know, like we have a service robot in the care home, that when the robot saw the person, then it will say hi, and then based on the last conversation that they had, and they will build, and they know what kind of songs they like, what kind of conversation topics that they would like to talk about. So that makes it a lot more meaningful.